friends, I am Dr. Kumar and I am a hematologist and a bone marrow transplant physician at Marrow Asia Hospitals, Gurugram and Faridabad. Today we are going to talk about aplastic anemia, a disease that was maybe 2 decades ago was considered that 80% of the people who are diagnosed to have aplastic anemia would die from this disease. But now in 2025 we say 80% of the patients who are suffering or diagnosed to have this aplastic anemia can be permanently cured using the treatments that are now available for this disease. So what is aplastic anemia? Aplastic anemia means the bone marrow where the production of blood takes place, that is, factory where the blood is produced is completely shut down. The bone marrow is not able to perform its function of producing normal blood. That condition is called as aplastic anemia. How do we diagnose it? The person who is suspected to have aplastic anemia will need to visit his hematologist. The hematologist will do a battery of tests including a complete blood count, reticulocyte count, LDH. These are all essentially blood tests. That will be followed by a bone marrow test, a simple test that requires hardly 5 to 7 minutes, done under local anesthesia so that no pain is experienced by the patient who is undergoing a bone marrow test. This test ultimately shows that the bone marrow where the normal cells should be present, that is empty. The bone marrow is not showing any cells that are responsible for the production of the normal healthy red blood cells, WBCs and the platelets. The bone marrow shows it is empty. Another test that will be done is something called as flow cytometry for PNH, because that can be an associated condition with aplastic anemia and that also helps in deciding the proper treatment for a particular patient. Another test is something called as stress cytogenetics that is recommended if a particular patient suspected to have aplastic anemia is under 40 years of age to confirm whether it is a childhood related aplastic anemia. Once a diagnosis is confirmed, how do we treat it? As we were discussing, the treatment has shown revolutionary change in terms of outcomes, and the treatment that has impacted most is bone marrow transplant. If you have an aplastic anemia patient who is known to you, is younger than 50 years of age, he should undergo an allogenic bone marrow transplant using a donor stem cells from his matched related donor. The outcomes are to the tune of 80 to 90% cure rate. Just imagine, out of 10 people who undergo bone marrow transplant with a matched sibling donor for aplastic anemia, 9 people out of 10 people will get permanent cure from this disease. There are predictors of outcome that who will have a better outcomes as compared to who will not. And one of the very important factors that decides is the number of transfusions, blood transfusions that a particular patient receives before undergoing a bone marrow transplant. If the person has received less than 20 blood transfusions before the bone marrow transplant, their outcomes are superior as compared to those who have received much more blood transfusions before the transplant. So earlier the transplant is done for a patient with aplastic anemia, the better are the outcomes. There are other parameters like the younger age of the patient, the number of CD3 cells or the lymphocytes in the peripheral blood of that patient, the matching level of the patient with the donor. These are the other parameters that decide the outcome, and maybe if the outcomes can be impacted, more than 90% of the people today can be permanently cured from this disease. What are the common symptoms that a particular patient suspected to have aplastic anemia can present with? The most important symptoms that are related to the deficiency of blood in the body. That means low hemoglobin, low WBC and low platelets. The person with low hemoglobin will feel weak, lethargic, unable to concentrate. All these symptoms will be present in that patient because of low hemoglobin. Low platelets. Platelets are responsible for hemostasis in the blood. That means they are responsible for blood clotting that happens once there is a cut in the body. So if the platelets for a particular person are low, they will continue to bleed despite the appropriate hemostasis being applied to the site of cut. So low platelets can result in increased and prolonged bleeding. low WBC counts essentially are resulting in low immunity, and this low immunity can show up as recurrent or repeated infections involving different sites of the body, whether it is lung infection, whether it is skin infection, whether it is abdominal infection, any site, any type of infection can practically take place in patients who are suffering from aplastic anemia. So be aware about aplastic anemia, because a hematologist, if approached in time for this type of deadly disease, can get a permanent cure from this problem. So say no to aplastic anemia. Thank you.